And we welcome from Healthwatch USA, Dr. Kavanagh. Dr. Kavanagh, good morning.
Good morning, Scott.
Before we get to some of the things that you said you wanted to talk about, I want to ask about an announcement from the National Institutes of Health yesterday. Earlier, we had gotten, did they call it emergency approval for use of what's known as convalescent plasma? And yesterday, the National Institutes of Health issued a statement saying there's insufficient data to recommend either for or against. And I'm not sure if that's damning with faint praise or just kind of shrugging, saying we don't really know at this point. How do you take that?
Well, I take it that we don't really know at this point. But for me, when I looked at the data and the fact that over 30,000 people have already been given this drug, some reports are up to 60,000 people, I still think it should be on the table for physicians to use. I think that we talked about this somewhat last week. The move of whether or not to have emergency use was more to relieve paperwork of the physician rather than to indicate that the drug should or shouldn't be used, because it already is being widely used. So I'm not really sure how much this does matter. What did disturb me was that the initial announcement definitely overstated the efficacy of convalescent serum. I think it provides a modicum of effect, but to say that it's going to cure 35% of the people, and that's the impression you leave the audience, well, that's not really what it does. This was a very small subset. When you just get symptoms, you're under the age of 70, you're not on a ventilator, and especially the just getting the symptoms. I mean, most people don't get into the hospital till they've had symptoms or a diagnosis for at least a week. And so the convalescent serum was really turning to be more like a treatment that you would see for rabies, where you have to give it immediately at the time of diagnosis. And that was the guidance, 3 days within the time of diagnosis. So to me, it was a minimal type of effect that was overblown, and now they're trying to walk that back some. I don't know what to make of it. I mean, I've never seen this before with scientific community or oversight within the federal government.
All right. And you mentioned rabies, but it also sounds like some of the treatments we see for flu that, you know, if you can get this treatment within 24 hours of your first symptoms showing up, then it may help you get better a day or two earlier, is the feeling you get from some of the flu treatments we see during flu season.
Well, yes. I mean, this is common with flu, with rabies, with a number of viruses. You have to give it really fast on the front end. Now, that's good news for, I believe it's Eli Lilly that's making the serum that's going to be manufactured. It's made in a test tube rather than taken from a person, because they'll have a lot of high quality, high dose serum that could be theoretically given right away, and there'll be enough of it. But right now, with convalescent serum, you have to give it early. And the other thing I didn't mention is it has to be the highest dose in order to get the effect that they were touting during that news briefing.
All right. What is the new CDC policy about testing for community spread and asymptomatic carriers?
Basically, they said we don't need to do that. And to me, that is crazy. If you're stating that this is a dangerous virus, which they are, and I think that most people agree on that, not everybody, but most, then you need to screen for community spread and asymptomatic carriers. It just makes sense. And the vast majority of the public health professionals and experts really disagree with the CDC on this. As you know, we've also had problems with recommendations of the type of mask to be used early on, whether or not there's asymptomatic spread, whether or not there's aerosolization. And to me, the CDC looks like they're under a lot of pressure that they shouldn't be under. I think that the oversight agencies really need to step back, let the scientists at the CDC make their recommendations, and have them come out so that we can have the best chance of defeating this virus. We're not going to defeat it by sticking our heads in the sand and by not looking for the virus. Makes no sense.
All right. You sent me a link to an article about how people are viewing healthcare workers. And even though a lot of officials throughout all of this have been calling our frontline healthcare workers heroes, apparently the general public doesn't necessarily, may feel that way, but doesn't want to spend time hanging around with them. Is that correct?
Well, that's correct, and that's somewhat disturbing. This was a new study that looked at 3,551 adults in Canada and the U.S. It did not involve healthcare workers, but the general population, and 33% of the respondents did not want to be around healthcare workers, and 32% believed that if they worked in the hospital, they were likely to have COVID. Well, first of all, they work in the hospital the entire time. If that theory was right, they would either be dead or be over COVID. You know, it doesn't hang around for 6 months. So that's kind of crazy. The other thing is that the healthcare workers of any of the frontline workers have the best protection, the best PPE. They follow advice. They know how to handle infections. So when you compare a healthcare worker to someone who's working at a bar, someone who's a waiter at a restaurant, someone who is delivering groceries or checking people out at the grocery store, they're going to be, in my opinion, less likely to be carrying COVID than those individuals. So I really think that that is unfounded. I can understand why the paranoia exists, but that's just one more thing that the healthcare workers shouldn't have to deal with, because they're under even more psychological distress than the general public. They have to see the patients, they take care of the dead, they take care of the extremely ill patients. In the general public, we can believe it's not around, stick our head in the sand, don't do testing, don't believe in the numbers. Healthcare workers can't do that. They go into the hospital every day and get a stark shock of what the reality is. So when we say the healthcare workers are heroes, let's treat them like heroes. Let's get them the proper PPE, the proper respect, and let's not ostracize them and view them as being almost expendable, because they're not. They are true heroes.
Tell us about Healthwatch USA.
Well, Healthwatch USA is a nonprofit patient advocacy organization and also a research organization. We have abundant resources on COVID-19 at healthwatchusa.org. Just click on the little viral button. We have educational courses and materials for continuing education of doctors and nurses, and it is, I think, a very good and productive organization, and please visit our website.
All right, Dr. Kevin Kavanagh, thanks as always, and we'll talk to you again on Friday.